Good morning, everyone. I'm Deanna Palm, President and CEO of the Washington County Chamber of Commerce. Welcome to our continuation of our Small Business Solution Series workshop. Thank you all for taking time out of your day to join us here today. I want to thank and recognize our sponsor for this, for our workshops, which is Hawthorne Farm Athletic Club. And we are pleased to have with us Heidi Sivers-Boyce, PhD, and the manager and owner of Hawthorne Farm Athletic Club. Heidi, welcome.
Oh, thanks so much, Dana. I'm just going to start with a quick Happy New Year, everybody. The end of one year and beginning of another is often kind of a time in business where we wrap up and assess financial performance, business performance, plan ahead, and a lot of people do that in wellness as well. I always like to begin these Small Business Solution series with just a reminder that no business solution is going to work or last if you aren't taking care of the people behind it, which includes yourself. So New Year's is a great time to do that. If Hawthorne Farm Athletic Club can assist you in any way, please reach out. And thank you so much for being here.
Thank you so much, Heidi. Yes, it is resolution time, isn't it? And it often goes with, increasing health and doing things, wellness. So spot on, and welcome to the new year. So I'm very excited to have with us and really appreciative that the folks from Washington County Health Department are taking time out with us today. As much as I like you guys so much, I'm like, do we have to talk about health still? But here we are, and really appreciate the fact that you're willing to come and meet with our members and give them an update on what's happening. Business loves some sort of certainty, and we have had nothing of the sort over the past 2 years. So again, thank you again. It's my pleasure to introduce Mira Simantel. You are the interim director of Washington County Health, as well as Marie Bowman Davis, PhD, and you are the Public Health Division Manager. Welcome. I'm going to turn it over to you, and I know you have someone else joining you, and I will let you introduce them when they arrive. Thank you so much.
Thank you so much, Deanna. And I just want to say thank you for inviting us here today. I agree with you. This is not how any of us wanted to start 2022. I think all of us were hoping that by now we would be in more of an endemic phase or be done with COVID, neither of which is the case. So we appreciate you having us here today. We see this as an opportunity to support our local businesses and make sure that you know the good work that we're doing and how we can support and partner with all of you as we continue to deal with COVID and this new surge from Omicron. So really, I'm just going to turn it over to our excellent public health team. So we have Marie Bowman Davis, who's here with us today. She is our public health division manager and local public health administrator for Washington County, and then Dr. Kimberly Rett, who is our chief epidemiologist. And they have a PowerPoint prepared for you, and they will talk you through. And please don't hesitate to ask questions. We want this to be interactive, and we have lots of good information to share with you. So again, thanks for the opportunity, and I'll turn it over to Marie. And you're muted.
Good morning. Thank you, everyone. Would it be possible for me to share my screen? Let's see. There we go.
I think have you got it, Marie?
I think you gave, yes, I have permissions, and I think, yes. Okay, wonderful. Well, COVID-19, yes. We have an update for you today, and let's go ahead and get started. So as you may have heard or seen on the Oregon Health Authority dashboard, we are having an increase in our cases as predicted. January 3rd, we had over 4,500 cases reported statewide, with 610 reported here in Washington County. So these are record high cases. And we are seeing some increased hospitalizations, and community transmission rate remains high. So not the best news, but it is what we were expecting. So why were we expecting that? As Omicron spreads much more quickly than any of our previous variants, including Delta. We are experiencing the surge in cases now, and will continue to do so in the coming weeks. We'll probably see more people in the hospital, and we could probably expect to see some workforce impacts, people needing sick time, to stay home, to isolate, to quarantine, which is what we're hope they're able to do, is if they're having symptoms, stay home if they're sick. And so we have prevention tools. So as we're experiencing Omicron, we're in a better place than we were at the beginning of the pandemic, nearly 2 years ago. We have vaccines for 5 and older, boosters for 16 and older, and pretty soon we're expecting boosters for 12 to 15. They have to go through some approval processes in our region and our state first. We have therapeutics available, we have self-tests, and of course, we continue to have masks. So we have lots of tools available to us, and we're feeling like we're in a pretty good place. And so you're going to probably start to hear some pretty consistent messaging nationally, statewide, and locally around getting vaccinated and boosted. We know that's the best protection against severe disease, illness, and hospitalization. To continue wearing well-fitted masks when you're away from home, keeping our gatherings small and outside if possible, and continuing to wash our hands frequently to prevent the spread of disease. Washington County and our team works really hard to keep the most current vaccine information available on our website. Vaccination clinics, booster clinics, we have some that come in from the state. We have, we're working with our local community health organizations to provide vaccinations and boosters. We've got a team of people that we're collaborating with, and even if we're not providing the direct service, we are making sure the community is connected. So that website is updated frequently. Isolation and quarantine guidelines are changing. CDC made some recommendations for healthcare workers and the general public. And so as we see those changes, we will continue to update information on our isolation and quarantine webpage. There's continues to be some economic relief for households and individuals. And those resources, again, are available on our website. And then economic relief for businesses, we do have a page on our website that's from our county administrative office for business recovery. And so that is all I have for today for the update. I'll stop sharing and turn to the group to see what questions you have.
Marie, I'm sorry to interject, but I kind of want to highlight that first slide you shared with the case counts. I think, those of us in public health, we live and breathe these numbers every day. But we said it's the largest number we've had to date. I'm just wondering if maybe you can kind of speak to that trend line, because it's more than just the largest number. It is a breathtaking larger number, and not in a good way.
Sure, I'll turn that over to our chief epidemiologist, Dr. Kim Ripp.
Thank you, Dr. Bowman Davis. So Omicron is bad. There's no way of putting that in a nice little happy kitten package, unfortunately. So the case count that Mara is speaking of is 4 times higher, actually over 4 times higher than any case count, 3-day case count we have had. So even though Omicron is causing less severe disease, if you have 4.5 times more cases, you are going to have more hospitalizations. You are going to have more deaths than we did in Delta, even though Delta had fewer cases. So you can look at what's happened across the country in states that have already started going up. It is a vertical line. We're not even talking like a gentle ramp up that we had for Delta, and we're just starting ours. So it is going to get really, really intense here for a while. Omicron, the boosters are protecting 50 to 80% of Omicron based on studies that came out this morning. So that's good. It's not perfect, but that's good. So that's still a better shot that we have in literally to protect us from COVID than some of the other, waiting for chemotherapeutics, for example. So I'd be happy to answer any questions you might have around that. Kevin?
Yeah, the numbers, it says all these cases have gone up and stuff. How many of those do we know are people that weren't vaccinated that just refused to get the vaccine the first time around and are out there running around, oh, hey, now I got it?
Yeah, I've actually done quite a bit of media talking about that exact issue. So the overwhelming majority of patients that are hospitalized and are dying are unvaccinated. And we're talking in the 90–95% range. Now with Omicron, the people that are getting infected, it can be a breakthrough infection. We are having people, 20% of cases approximately, that they are fully vaccinated and boosted. So it's not a guarantee that you're not going to get Omicron, but we are still seeing in terms of the severe cases, it's almost exclusively in unvaccinated persons. Kevin, does that answer your question? Okay, thank you. Heidi?
Yes, hi, thanks. I am wondering, as a business owner in a health club and office settings, what if we were listening to you and doing anything, what would you like us to do? When I know the government shutdowns and heavy rules and all those are very controversial, but at least they provided clarity as a business owner. Okay, here's what I'm supposed to do about it. And one of the challenges, and everybody, so many businesses are going through it, is what policies should we have? What practices should we put in place? What should we do to be responsible citizens over the next 6 weeks or so? So if from your point of view, what would you like me to do?
Thank you for caring. I just want to say that I appreciate that you care about your staff. I appreciate that you're trying to keep people safe that go to your business. So thank you. We are very grateful for that. Some of the things that you could consider doing would be, making sure if your employees are sick, they are able to stay home. We have a lot of businesses that maybe there's a little more pressure applied to employees. It's like, oh, you just have a stiffly nose or something like that. You really don't want someone in shop if they're sick. So allow your employees to quarantine. Encourage vaccination as much as you are able and willing to do so. Get good masks for everybody that's indoor. And if it's possible, and I understand it might not be possible at your particular business, but if there is remote work possible for some staff, that would be valuable as well. So basically trying to keep the exposure as low as possible for your people and the people coming in. Does that answer your question, Heidi?
Yeah, it sounds familiar.
Yeah, it is. It's nothing new. Yeah. It's nothing new. I'm not saying anything new. Yeah, just encouraging you. Mm-hmm. Yes, yeah. Absolutely.
Yeah, got it.
Thank you for the question.
Yes, and thank you. And Heidi, I really appreciate you saying that nothing new. That's great. That's what we want to hear. We know what to do. We've been doing it. We have our indoor masking policy. It's going to stay around, at least for the foreseeable future. The things that we're doing now and we're doing well are the things we want to continue doing. And so we're going to see a little bit more of that stable messaging, and that'll be our best way forward.
Brad.
The question, is there any data on reinfection? If someone has had it from, one of the other strains, what do they have any kind of immunity? Because you read all kinds of different stats.
Yes.
It's hard to tell.
Oh, it totally is. Oh, talk to me about it. Like I have to sit there and try and wade through it myself, right? So yes, Delta kind of got you a little bit of protection from Alpha. We can't even remember Alpha, like way back in the darkened times 2 years ago. So what's interesting right now, early studies are suggesting if you're infected with Omicron, you are protected from Delta. And that's the first time we've kind of seen that sort of overlapping protection, because infection with Delta certainly ramped up your immune system, but it didn't protect specifically against another strain. So backwards, nature isn't going to go back to Delta, right? That's not going to happen. Something else will be. Whatever's going to happen after Omicron is already in the works out there somewhere. So Omicron gets you Delta. Previous infection does not protect you against other strains. So far, we have not seen that, and only Omicron back to Delta. So it's something, but it's certainly not enough. It's nowhere near compared to the protection that you get from getting the vaccine. And we encourage everyone who has tested positive to still get vaccinated, because again, one strain does not protect you against all. Does that help, Brad? I know it's not good news, I'm sorry.
And another kind of a follow-up on that, if you've had one of the other strains, or you even if you have Omicron, do you still suggest boosting? And is there a waiting period of when you've been sick with it, of how long you should get boosted, or what to tell your employees, if they're out and they haven't or have been boosted?
Great question. So everybody should get boosted, period, unless their healthcare provider advises them otherwise for some sort of autoimmune disease or something. So yes, but there is a waiting period, certainly, and your healthcare provider can give you that information. I mean, usually if you're like very, very sick, they want you to wait 10 days or sometimes a little bit longer. And it depends on which vaccine series you're on. But yes, if you are actively sick with a COVID infection, do not go get boosted, rest, wait, and then your healthcare provider or the vaccine people at the clinic can tell you you need to wait this amount of time. But it does depend on your disease severity. So asymptomatic doesn't have to wait as long as someone who is hospitalized, for example. You need to give your body time to recover and kind of just level out a little bit before you re-challenge your immune system.
And is boosting still 6 months after the second dose? So
well,
if you had employees that were boosted, or not boosted, but got their vaccination 4 months ago, should they get boosted now or wait the 6?
Boy, so as we are speaking, those recommendations are changing. They're actually changing it to 4 months for very specific populations. Probably by the time this call is done, it's going to have changed again. I would recommend that people get boosted if they are eligible to do so. There's no harm in doing it now.
So that's a really great opportunity to highlight how if something happens at the federal level, then there are still several steps that have to occur before our local healthcare providers can then offer a booster at a different time frame than what they're doing now. And so it's usually an indication when you see CDC recommends, then it's an indication that there's possibly a change coming locally, but it's not immediate, which is why I think I'd also like to highlight again our website. We put the most current information, so you know when those boosters will be available sooner than 6 months, which groups can get boosted, when 12 to 15-year-olds will be able to get boosted, and at which locations. So there's so much variation with vaccine and boosting. Our team works really hard to make sure that they have all that information in one place for you.
And Elisa.
Yes, my question was in regards to the boosters as well. We've had some employees talking about getting theirs, and they've gotten various initial vaccines like Moderna or Pfizer or a few Johnson & Johnson, and they are asking if I have any information as far as the research out there that it has been done on, if you got Moderna, should you get another Moderna, or Pfizer, should you stick with Pfizer, or should you mix and match to get the best immunity? What resources are available to
Well,
share?
I can tell you what the clinical studies say, if that would
Perfect.
be helpful.
Yeah.
Save you some time. Okay, so if you're J&J, my answers include from the clinical studies that showed basically effectiveness pre-Omicron, right? So if you're J&J, J&J was the least successful out of all the vaccines. So they're recommended for if someone had J&J to get Moderna. If you had Pfizer, you can get Pfizer or Moderna. And if you had Moderna, you can get Pfizer or Moderna. So if you're vaccinated with a Pfizer or Moderna series, there's no real change. It's like a 0.2% difference between Moderna and Pfizer for the booster. So you can mix and match. I had all Moderna. I don't know why. Maybe it's just my OCD, but I could have easily done Pfizer. It doesn't matter. What does it does matter significantly for people who have had J&J. They need to go through the Moderna booster.
And what if they, would that recommendation change if they have had COVID?
No,
Okay,
doesn't change it.
thanks.
Thank you for your great questions. I really appreciate it.
Heidi.
Yes, just back to the what do we do? People should stay home when they're sick, wash their hands, get everyone boosted and vaxxed, get really good masks. I'm curious about the physical distance because I have a business where that really matters. I am aware that Omicron is so much more contagious. Is there updated guidance on physical distances, 6 feet now, 10 feet, or is there any science around that could give me guidance?
So we were looking at that a lot back with Delta, and I'm sure as you're aware, the World Health Organization said something very different from the CDC, and they were getting in their little discussions as they do, which is very fun to watch as an epidemiologist. And officially, the more physical distance you have, the better, period. And end of discussion. And every amount of space that is closer is an increased risk. So 2 feet, not great. If someone is actively aerobic and not wearing a mask, I would not be anywhere near them.
Okay, but what would define anywhere near? I know I'm pinning you down. I promise not to.
Well, I mean, if for just speaking, just regular speaking, we're still looking at 10 feet. Nobody has looked at aerobic because that is not ideal to be around someone who's aerobically breathing.
We have everyone wear masks, but it is not popular at all. People do not.
Of course, it's horrible to exercise. Yeah, absolutely. I agree.
It is important. Yeah.
I agree. Yeah, that would be as much distance as you could provide between, like, if possible. Again, this is not a mandate. This is not anything forced from the government. This is just recommendation upon science. Space people out as much as you can.
Got it.
Like,
thank you
the people who are actively exercising, just try and space them out.
Yeah, that sounds great. Let's keep doing what we're doing is the ongoing message. Thank you so much.
Thank you, Heidi. I appreciate it.
And Kim, I would just add, and please correct me if I'm wrong, but this is what we know today. And as we know, it's shifting. It'll shift by the time we're done with this meeting. It could shift tomorrow. So what we're telling you today is this, but we don't know what the recommendation will be next week. So again, it's, look to our website. It's going to be the most current information, because if you just listen to what we're saying today, a week from now, there may be other guidance that you need to be following.
One thing I can promise you though, with Omicron, they're not going to tell you to get closer to people. That I will promise you in front of all deities at the moment.
Kevin.
So one of the things, in my company, we do training in person. And so we have people in a room. We require all masks. We do the temperature checks. And then we ran 2 HEPA filters the whole time during the class to circulate the air. Is that okay? Or is that, no, we shouldn't really do that. We should just go online and do classes.
If it's really important to be in person, those are great steps. Having active HEPA filters, especially if they have UV in them, outstanding. That is really, 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 that's a great safety option. If you have that, well-fitting masks, making sure they're not like napkins, essentially. Great. Keeping your, inside a space. If you can leave a door open for ventilation, that's good too. Keeping the physical distancing as much as possible in that space. That is as good as you can do, besides making sure everybody's vaccinated and boosted, for everybody to be in a room like that. So that sounds great what you're doing.
I have a question about home testing. So now it's, everybody we have to home test. So can you talk a little bit about when the testing is going to be most effective in terms of, you have people calling saying, I was in the car with you and my cousin who I was with 2 days ago has now tested positive. So if I go get a home test and I test negative, what are chances I'm really negative?
Great question. And that's something that everyone is working out guidance on right now. So the deal is there aren't a lot of tests left. That's kind of the problem that we're dealing with. So if you are exposed to someone, the best practice, if you are exposed to a known COVID case, then the best practice is to isolate and quarantine. If you're going to do an at-home test, if you can get your hands on one, which I'm not 100% sure you can get your hands on one right now, but if you can, it's going to detect Omicron specifically because that's the most rapid onset between 3 and 5 days after exposure. But again, we are not recommending necessarily a test out strategy at this time because there aren't enough tests for everybody to do that. So I'm just being transparent about that. I don't want to tell you to go get tested when you can't go get a test.
Thank you for that. I think if I'm not mistaken, did the Biden administration announce that they were purchasing a whole bunch of home tests that would then be available? So do you know anything about that process or timing?
Boy, maybe Dr. Bowman Davis has more idea. I know that Oregon, I saw the receipt that Oregon has replaced their order. I do not have the time for what they will be on site and available to all of us. I haven't seen that information yet. I mean, stockpile issues can get tricky.
Right. So I can't speak to my knowledge about where the supply chain is with the federal government. My understanding is that is supposed to support an influx. However, we do have calls with the Oregon Health Authority and their purchasing of home tests. And those are being prioritized for high-risk settings and community-based organizations. So there is a statewide criteria for how our state purchased home tests will become available within our communities. For example, someone that's experiencing houselessness or homelessness and is in a warming shelter, right? So we want to prioritize tests for those settings. And so they're called home-based, but it's so that the individual doesn't have to go to a lab, right? And I do also recall from and Dr. Rep, correct me if I'm wrong, I recall from our statewide meetings, Dr. Seidlinger mentioned that the home-based tests, we understand that they are most sensitive or effective when experiencing symptoms. So they're not a good screening tool. They're good to identify if there's active disease. So having COVID symptoms, you're more likely to get a reliable result.
Got it. Thank you for that. And I guess my only pitch would be to, at some point in time, if the tests become more readily available, to help the business recovery centers get them out to businesses, because that's another huge expense and struggle of trying to figure out how to find them. So if there's a resource that we could provide, we'd appreciate that.
Absolutely. And we are feeling hopeful. There's the FDA just approved another, it's called iHealth Kit. So there's another tool that's coming on the market. So again, things are improving, things are getting better in our space, more home tests, new companies, new treatments, so we are seeing improvements, and yes, definitely we have that on our list.
Excellent. Thank you. Shauna.
I was wondering if there's been any word of changes to the definition of fully vaccinated, if that includes boosters. I've got one employee who has very reluctantly got vaccinated and is really resisting getting boosted. And I don't know how to push it without some other entity saying that, that's fully vaccinated.
Oh, sorry.
No, thank you. We were just, and I will defer to Dr. Rep. We were just discussing that with our health officers and our local public health administrators and our leadership here in the county. And so the CDC has recently articulated or shared the phrase "up to date." So that's where the boosters come in. So you have your full series and you have your booster in the right amount of time, then you're up to date.
Yeah, and I would just add, from a layman's term, because I'm the non-physician epidemiologist here in the room, so it helps me understand is you're fully vaccinated when you have, that two-part series or the J&J, which we know wasn't as effective, but still you're considered fully vaccinated. It's that booster addition is the up to date. So if somebody had their two-part series, you can't say to them you're not vaccinated, because they are fully vaccinated, but they're not up to date. So that's the nuance, and that's what we know as of today. So we don't know, they could change the language soon, but that's kind of how we're framing it with our staff, because of course Washington County as an organization, we have our employees asking us, and we're trying to update our internal policies. So we're focusing on that fully vaccinated and up to date with that booster if appropriate.
I just want to echo your frustration, because trust me, every epidemiologist in the country is like, for the love of God, CDC, change it, right? It's upsetting as an epidemiologist to go to web pages and say % vaccinated. And people might think that means fully vaccinated. They might think that means boosted, but actually that only means they've had one shot. So you got to be real careful when you're looking at data to make sure, are you looking at fully vaccinated, the 2 shots or the one of J&J? Are you looking at boosted, or are you looking at has had any vaccine? So I agree with you. I hope they will change it, but the ship moves very, very slowly here. And just what Mara, Dr. Davis said is that we can't override the CDC in terms of calling fully vaccinated something other than is accepted at the federal level. Does that make sense? But I hear you. I totally hear you 100%.
Brad.
So I've seen some stuff that says that maybe this Omicron is the push to move it out of a pandemic and into endemic, because so many people get infected. But you were saying earlier that no one knows what the next variant is. Then maybe Omicron doesn't do that, or doesn't provide immunity. Is there a silver lining in this ramp up, ramp down, in multiple people getting infected, or is that just trying to put a good spin on bad data?
So my hope, we're going to go through this up and down until either there's nobody left to infect because they're vaccinated or other things happen, or we're going to find a way for chemotherapeutics to help people, like treat people. But they being the scientists, the capital S scientists, there are multiple companies right now working on a vaccine because they have isolated specific markers within the virus that will protect against every single variant. Now, people kind of flipped out a little bit about being mRNA vaccine. They're really going to flip out about this nano vaccine, because then it's going to be like the Matrix, little machines running through your body kind of imagery. But they are actively working to get a vaccine that's just going to stop it. But until we get to that point, we're going to keep going up and down and up and down and up and down. Because remember, it's in the virus's best interest to not kill the host and to reproduce as much as possible. So nature's going to push it that way. Omicron doesn't kill the host as much, and it spreads. So the next variant, if there is one, which we have no reason to believe there wouldn't be, will be even more transmissible, because that's how the evolution would work. So we're going to wait for some superstar, even more superstar vaccine, I think, to get to the end.
Yes.
How far out is that? Is there any?
Well, I mean, it's got to go through clinical trials, right? Like it passed, stage 1, we've got to go phase 1, 2, and 3, and it could fail, 80% fail at stage 2. So we busted out these amazing vaccines in a year and a half, which is unprecedented. That it's going to take some time. This is a completely new technology. This is not something that we've had in vaccines before. So it's going to be much more heavily regulated than the others. I can't tell you, Brad. I wish I knew. I wish I could tell you, because I'd love to put that date on my calendar and sign up and get in line now. Trust me.
So just this conversation is get your mask, get vaccinated, get updated, and avoid people at all possible.
Yeah. Yep. Basically.
And Dr. Rep, just a follow up, because I think what you shared with Brad is what you shared with me and my understanding of kind of the trajectory of the pandemic. But I think to the point of when it becomes an endemic, with your statement, the goal of the virus is not to kill the host and to replicate as much as possible. So I think that's where, I think, and I know you can't answer this, but that's the question we seem to get a lot from the public is, so at what point does Omicron and COVID become more like a common cold, right? Where, so yes, it's super transmittable, but it's no longer an issue because it's not overwhelming the hospital system.
That's it. That's exactly when so technically we're already endemic from a formal epi perspective, like we have been for a year, but it's going to become normal when it is not a threat to our hospital capacity. That's when we can be like, okay, this is where we're at. This is where it's going to be. It's not a threat to shutting down our complete infrastructure. It still is a major, major threat to our hospital capacity. So when that changes, I imagine we will be like, okay, this is how we live now. So, and no one has said that formally, but from what I have seen and everything, that will be the changing point.
Thank you. I think that's it's such a clean message in some ways, right? Because I think that's just when people say, well, when is COVID over? COVID won't be over. The risk to our infrastructure and healthcare system will have resolved. And then therefore, society can go back to quote unquote normal.
Dr. Rep, I think I saw it on a credible news site today that France has identified a new variant. And so, every single time we hear this, we're all like, oh no, what does this mean? But this is the life of this virus, that it's going to mutate, variants are going to come out, and we're just looking for some sense of, where it's not impacting the hospital infrastructure. And I've said this before, and I would be interested in your opinion of this. I don't think we're ever going to get on an airplane again where we're not going to be forced to wear a mask, right?
I hope not, honestly, just for for measles, for meningitis, for all the other things that we have to deal with on a daily normal time basis that happens on airplanes. Gosh, yes, I would love everybody to naturally mask up during flu season like other countries do. That would be great. But to get to your question about variants, so there are over 50 variants out there right now circulating that we know of. So we are every time this virus enters someone's body, it's mutating and it's changing and it's changing. And that's happening as we're speaking right now in millions and millions and millions of people. We notice it when it starts to outcompete the existing strain. So right now, in some countries, Omicron is the dominant strain. So if a new variant were to be identified, for it to become a threat, it would have to outcompete the existing strain, which means what we talked about. It has to be able to replicate more efficiently than Omicron does, because it's got to beat out what's already there. So identifying new variants, okay, cool. It's definitely something we're going to look at. But when the alarm bell should start going off is when you see country level shifts of the percentage of the variant in the population. Like we got that months before we started having Omicron here, right? We were like, oh, it's Delta, a little bit of Omicron, more Omicron. A lot of Omicron. Like when you see that population level shift of the dominant strain, that is when we really need to focus on, okay, this particular variant is beating out what we have now. What do we need to do? Does it work with our vaccines? Does it not work with our vaccines? Do our chemotherapeutics work? That's when we start, quote unquote, caring about a new variant.
Yeah. And Dr. Rep, I think also there's the international surveillance, national surveillance, and then there's ranking, right? Like there's variant of concern. So Omicron, we knew about it, but it didn't become a variant of concern until it hit the thresholds that you're describing. And so that is also something to listen for in the media and when we're reading, because we're going to continue to hear about variants, and we have variants of flu all the time. And so I think, Brad, back also a little bit to your point about kind of living with COVID, we are starting to make shifts. So our goal in public health is to provide the most effective intervention at the time, when we first had our very first case here in Washington County, Dr. Rep was a part of that team addressing that. We were the first in the state, the first to learn about this. We had our investigative skills, our epidemiological skills to disease investigation, contact tracing, case investigation. Those tools we use all the time in Legionnaires, in all sorts of different measles, other outbreaks and clusters. And so we have those skills. And then as the pandemic shifted, like I mentioned, we have all those tools available now. So asking every single person how they were exposed is not our best tool right now. So you'll start to see more shifts, right? So our best tool to keep people out of the hospital is to prevent severe disease, which is why there's, the governor on December 17th said, hey, we want to get our community boosted. Right. And so you'll see that kind of messaging, and that those shifts is, looking at the hospital system, what is the most effective way to keep our community able to recover at home. Right. That's a success. If you're able to recover at home and you don't need to go to the hospital, and that is what we're looking towards. And so that's what you'll see more of.
Kevin.
Yeah. Because this has happened in the past. I mean, when do you think that COVID is going to be a required vaccine for students to go to school, like all the other vaccines, and, on a regular basis? Hey, you need to have your kid vaccinated on this.
That's an interesting question. So as we know, Omicron has higher fatality in children. I think the argument, the people who decide, and I don't even know who those mysterious people are that decide the vaccinations that children must have, would weigh sort of the effect on children a lot more than the general population. And that picture has dramatically changed from Delta to Omicron. So I think it depends on the risk assessment, what people think, like, is this an acceptable risk for our kids or not, in terms of the fatalities, hospitalization, and long-term consequences of infection with COVID. Fred?
Mr. Smith.
So you said that it's basically trying to not overwhelm the healthcare system. Do you see in the future it moving to a data point of we're just tracking hospitalizations rather than, you see these daily numbers of infections going up, and for someone like me, it's something you're like, oh my God, what, doom and gloom, as opposed to, okay, if their numbers are skyrocketing, but the hospital numbers aren't following. I mean, they're definitely going up, but they're not following. Do you see the state moving to we're just tracking hospitalizations and deaths as opposed to pure numbers?
So great question. When the virus is not as lethal for humans, and it in the amount of new cases and the hospitalizations separate, they don't parallel, it's called decoupling. So it's absolutely possible to have your case rates go like this, and your hospitalizations to just generally go up. That is possible. What's called decoupling. However, when your case rates go up so much, it's going to bump up those hospitalizations. Now, right now, there are two ways we get hospital information: case interviews. So we call them, we find out where you hospitalized. We're not going to be doing that anymore. So we're not going to get that information from speaking to every single case. However, the hospital systems independently all report how many beds they have open, how many people are on ventilators, what percentage of people in the hospital have positive COVID test, and of those, how many are vaccinated versus unvaccinated. So we will be relying on the hospital system itself to report that information. We are still going to be doing deaths. Of course, we're still going to be looking at that from our medical examiner system and our vital statistics system. But the case count right now, remember that everything that we're seeing is someone who goes in and gets a PCR test. All the at-home tests, anything that's not done in a clinical setting, doesn't get reported. So what we're actually seeing is probably half, if not less, of what the actual positive COVID tests are out there. So we'll continue to see the cases that are reported through the medical system. We'll continue to monitor the hospital capacity through their own reporting, and we'll continue to report deaths. Now, what we put the most influence on, I believe our governor is really focused on the hospitalization component, Personally, that's what I hear is important, but we will look at them all in some way moving forward, just to keep an eye. Hospitalization data lags 7 to 10 days behind case counts. So if we see case counts going up, we know we're going to get hit by a Mack truck in 7 to 10 days, and then start preparing for that. So that's kind of how we use case counts to help prepare for hospitalizations. Does that make sense? Did that answer your question? You're not happy, I'm sorry.
And I think that COVID-19 is a reportable disease, right? And so as a public health system, we're going to be tracking, monitoring, and reporting it. And we follow the kind of lead of our federal government. When CDC says we don't have to report daily case counts anymore, then the state won't report them, and we won't report them locally. We'll still collect them. We're required to, will always be required to report COVID. It's a reportable disease. It'll just, it'll just not be in the daily news. And I did put a link. Oh, hey, there we go. Thank you, Mira. Yes, I did regarding data and dashboards prior to coming on as the public health administrator in September. I worked on Dr. Rep's team with our COVID-19 data analysts. And so we would try and make sure we had the cleanest, most quality data to provide the state and the federal government. And so when it comes to public dashboards and visualizations, there's kind of a hierarchy, I guess, in terms of where do we go for what information. And so the state is monitoring variants and the CDC is monitoring variants. So those would be the two sources that I would recommend for variants. If you're really interested in what's going on in our region, on how Washington County is compared to Clackamas County or Multnomah County, we've gotten together and we have a regional dashboard on Multnomah County's website. So we have worked with the community to present the data in a way that they'd like to see it represented. And it differs a little bit from how the state reports, but if you're interested in a regional comparison, I put that link in the chat. And then that's where you'll find Washington County data, is we work collaboratively with Multnomah County and Clackamas County. And the state also has, like, for the vaccinations, the state says, hey, this is what's going on in vaccinations. And then they have a little drop down where you can filter to Washington County to see the fantastic, we have outstanding vaccination rates in our county. I mean, just outstanding. We're closing equity gaps. Our team's been working really hard on that. And our community has stepped up and young people are getting vaccinated, people are getting boosted. And so our state dashboard for vaccinations. And so I can make sure to share those links with Deanna so you have them and kind of what information you're looking for, what's the recommended source. And Dr. Rep, is there anything you'd like to add for dashboards? We have lots of them in COVID.
If you have questions, reach out to me. It's all like up in here in a steel trap or a rusted, corroded, empty steel trap, but I will help you get the data you need or understand the data you need. So just reach out. We're here for you.
I've got another question on the hospitals. I'd read early on that the state of Oregon is one of the lowest per capita hospital beds population wise. Do you think is that an issue going forward? If this is, pandemics are going to be a thing of the future, does Oregon need to build more hospitals? I mean, that's a loaded question that is way out of my pay range, but I would say yes, absolutely. I would say we don't really want to aim for being lowest of anything in the country, personally, across the board for anything. That would be great, but we don't have a lot of land and there are lots of other political issues there. But
well, yes, and if there's primary, secondary, and tertiary prevention, and we hope to keep people out of the hospital. And some of our hospital capacity, we support our neighboring states, we support our neighboring counties here in the metro region. And then also there's, staffing, right? So there is physical space there. I recall being in a meeting with our healthcare partners. They said, we built a whole new wing and we have all these beds and we have all this equipment and have a healthcare shortage. We need to get more people through school, and we need a more diverse workforce, and we need people that represent our community and can provide culturally and linguistically appropriate services within our community and build that trust and the authentic relationships. And so there is an upstream we need to work on, the workforce development piece of it, and in our public health infrastructure, our workforce development to help with the population level prevention, to do our best to have environments in where people have equitable access to resources and can live and develop and grow and be healthy, so that they don't need to go to our hospital system.
Maria,
Kevin.
Personal experience, because I just was hospitalized in the hospital for something else. The nurses that were working on me are a national database that they are volunteer nurses that go to where there's a need, and they get a contract for 3 to 6 months. And so there was 8 of them in the ER that day that I was there, and they're like, come, he's telling me, yeah, I've been to Baltimore, Chicago, here. And it's like, I got a 2-year deal here in Oregon, so I'm going to be here for a while. And I was like, oh, wow, that's cool. So, and they just travel, him and his wife just travel all across the country, wherever the need is. So.
Thank you for sharing. That's amazing. And I hope that when this emergency response piece is over, that some of those health care providers will look to Oregon as someplace they can call home.
So I guess as sort of a last comment, what advice would you give to our small businesses that are just kind of weary of all of this? How do we keep them, moving forward and getting us to whatever that finish line and wherever that finish line might be?
Yeah, Deanna, that is such a good question. I think we're all pausing because I'll speak for myself. I'm reflecting on, we're there too, right? I think we're all there. You guys are weary. Your customers are weary. Our public health team is weary. The nation is weary, right? But I think, there is so much good news. So I think that's what I would focus on. I mean, we have the tools. I mean, how cool is that really, if you think about it? Like, we have masking, we have vaccines, we have boosters, we have protocols in place. We can clean, we can social distance. Like, technically, we have all the things we need. We might be tired of doing them, but it's not like we're sitting there with no options. And so, and as Kim's talking about, there's even more work that's being done at vaccinations that could prevent even future variants, which would be incredible. So I think it's focusing on what we do have, which is a lot. We have everything we need truly to be safe and to battle this pandemic. And we just need to dig deep a little longer. We're still open, right? I mean, there's things that aren't like they were a year ago. So we have made progress, we have made gains. So that's what I would focus on, is the good things that we have and the hope that's coming down the road. And to also just know that we're here for you. So if you're having a down day or you're having questions, reach out to us and we're happy to support you.
Great way to end the program. Thank you again so much. I want to thank the Washington County Health Department. You have been extremely accessible to the chamber, to our business community, keeping us up to date. Great tools, great resources, great support. Thank you so much for what you're doing and what you will continue to do for our community. It's truly appreciated. Also want to thank Heidi and Hawthorne Farm Athletic Club for supporting our program. And we look forward to seeing you in 2 weeks, where we will be talking about the Oregon State, it's the IRA program. I'm going to get it wrong, Kevin.
Oregon Saves.
Oregon Saves. Thank you very much. Program, because lots of confusion with our employers around that and what that means and how they go about doing it. So please look for that information and plan to join us. Have a great rest of your day. Please stay safe and take care.
Thanks for having us.
Thank
Have
you.
a great day.
Thank you, everyone.
Thank you.